Welcome back, everybody. I hope you enjoyed John and Josefa's exercise breaks. It seems kind of simple, but there is so much research behind what goes into the exercises that they're doing. That multitask or dual task, reaching, talking, and thinking, it really is an incredible field of study right now. Josefa, if you're not familiar, is finishing up a doctoral degree in Lisbon. Actually, her advisor is Boss Bloom. So, she's very connected with Parkinson's. She has a 20-year degree career in PT, and the majority of that has been working with folks who have Parkinson's disease. We've got a number of their exercise programs on our YouTube channel. If you like what you see, if you like what they're doing, and jump in and grab them and do them over and over again.
Let's not forget that we have to add aging to that list of things that we're all dealing with.
Yeah, I don't want to turn around and show that patch behind me. So thank you guys so much for participating. We've gotten a lot of comments in the chat saying how really helpful this was, and I think if anything, maybe you could just kind of share some more insight. And I often think, the interaction between you guys is going to be really helpful also. So let me just ask a question here. If you could share one message to someone who's newly diagnosed with Parkinson's, what would it be?
I would say from the medical standpoint, and I would have appreciated this, is that Parkinson's disease for most people changes very slowly. And I've had it for 14 years, and so I feel lucky that I'm as healthy as I am. But I thought that when I got diagnosed, every little thing that happened to me, if I tripped or if I, missed a step or whatever, that it was always related to Parkinson's disease. And it just, if you wake up one day and you feel really rotten, it's probably not your Parkinson's disease, because it just doesn't change that fast.
Yeah, I think that's exactly right. But part of it is aging. 71, and I've had orthopedic procedures and total knee replacement. And some of the pain and stiffness I have is due to past sins, not necessarily Parkinson's disease. Yeah.
I would say that we is stronger than I. Getting back to the community piece and whether it's Parkinson's or any other hardship we face, you're much better equipped doing it with other people than you are trying to do it by yourself.
Here's a question. It says, what would you say? Whoops, I just lost it there. What would you just say to someone who has advanced Parkinson's disease and refuses to exercise?
I have a cousin that has Parkinson's disease, actually a second cousin. And this is hard. And it may be the doctor in me, but it's like an alcoholic who refuses to admit they have a problem. You really can't help them. And you have to not beat yourself up if they decide they don't want to exercise. They are the captain of the ship. They're the captain of their own ship. And if they decide they don't want to, I can't do any more than that. I can't force them or make them mad at me by insistence on exercise or me trying to tell them what's best for them. They have to take all I can do is supply the information and let them decide. But I have to be careful as a caregiver not to take on the responsibility for their outcome. Or beat myself up because I didn't get them to exercise. No, it has to come from within with alcohol or drugs or like a friend of mine didn't want to have a knee replacement, would gripe about his knee pain all the time. Well, okay, but what you need is a knee replacement. And short of that, nothing's going to stop your knee pain. So that may be kind of hard, but the caregiver can't take it on themselves to blame themselves because the patient won't do what's best for themselves. My perspective.
Other comments? You know, mood can be a big part of Parkinson disease also, depression and apathy. And have you guys struggled with that at all or not?
Oh yeah, I have.
I struggled early on with a lot of anxiety, which has really dissipated since I became public about my disease, which was, I guess, a formal way of accepting it. I still have moments, where I deal with certain anxieties about the future and things like that. But, anxiety and depression are real. About 40% to 50% of folks will have anxiety, and maybe a little more will experience depression, but it's very treatable, as my two fellow panelists will know more than I do. It's medically very treatable.
Well, and there's something about, and I'm taking an antidepressant, but I think it helps my Parkinson's as well. I'm not sure what stimulates what, but I think it helps my Parkinson's to be on that. I'm on sertraline. Lots of choices.
People don't realize often is that people aren't depressed because they have Parkinson's disease. They're depressed because they have Parkinson's disease. It's the disease that's making them depressed, not the knowledge that they have a disease or an illness.
Right.
I mean, that might add to it, but that depression and anxiety it can be part and parcel of one of the non-motor symptoms of Parkinson's disease, and should be treated as such. And a lot of people, when they look back, it's their first symptom, non-motor symptom of Parkinson's disease.
Yeah.
But Alan, the stress that comes with keeping it secret is terrible. And you're so right, Alan. It is a personal decision. But I also tell people, if I was to do it again, I don't recommend it, because usually people notice something, and so they're wondering what's going on with you. And trust me, the other thing is that trying to keep it secret, when I found out that I had Parkinson's, all of a sudden the Parkinson's jokes, the Parkinson's references, they were around me. People didn't know I had Parkinson's, but all of a sudden it seemed to be the butt of every joke, having a conversation, all of a sudden left turn something about Parkinson's disease. And so it was, try to hide it and you feel like you can't. I mean, before I had diagnosed, I don't think I'd ever heard a Parkinson's joke, Parkinson's reference, or anything like that. So it's funny how that happens to you. So it just makes keeping it secret, all the more worrisome. You're like, they must know.
Just one more quick suggestion. This is kind of building off what Karen and Dan have both said in their talks, but on the person who's not willing or able to exercise, I think peer pressure can be helpful here. I mean, Dan talked about his boxing community, which I know a little bit about, and Dan and I are friends, so we talk a lot about these things. But having somebody kind of expecting you to do things sometimes gets you to do things that you may not do on your own volition. So that might be an indirect way to take a last sort of effort or a last try at getting someone to move on this.
It really is so key, because as a movement disorder, I mean, the less you move, the more symptomatic you will be.
Yeah.
I remember there was some point early on where I thought if I could just be Forrest Gump and never stop moving, I would never know that I had Parkinson's disease. And it is amazing, if anybody knows who Jimmy Choi is, this is a guy who kept his diagnosis from his whole family for years. Way too much weight, was walking with a cane, and took a tumble down the stairs, which woke him up and said, "What am I doing with myself?" And now he's an elite athlete. Now, I'm not suggesting that any of us become elite athletes, but it just goes to show you that you can come back from, pretty disabled to, pretty remarkable.
You had mentioned a little bit about humor, and Dr. Jaffe, I mean, you come from a household filled with humor with your husband, who was
Wait, clear. I'm funnier than he is.
Oh, okay.
I wouldn't argue with that, actually.
No, I wouldn't either.
One of the comments or questions is, have you all had to hone a new kind of sense of humor?
Well, there's a sense of humor that you have when you're around other Parkinson's patients. that you know, that nobody else would get. And so you have to be careful because, you know, people who aren't in the Parkinson's community might not think something's funny that we might think is funny. So do you guys have that experience too?
Uh-huh.
Absolutely, all the time. But, you know, in my family, you know, sometimes people ask, you know, how have your children responded to you having Parkinson's, and how did you tell them and all of that? And, you know, we were a family that valued humor before Parkinson's, and we've incorporated into that, you know, that aspect of humor into our sort of broader family practices. So I mean, I think humor heals, and I think it permits other people to sometimes feel more comfortable than they otherwise would. If you're sort of making light of the situation, it sort of gives them a little bit of an opportunity to exhale and to know it's okay to talk about it. So I think it can help the person with Parkinson's, but people around him or her as well.
Well, that's true. And I know that my phone is ringing. I'm trying to get it to stop ringing. I lost my train of thought. Oh, I know what I was going to say. For those people who are newly diagnosed, I mean, when we first got diagnosed, we didn't tell anybody. And it was like those that we told, it was like, you know, you have to come over to the house. We have to talk to you about something. And people thought that somebody was, you know, had cancer, Mark and I got divorced or something like that. And we learned that the way to tell is how you're going to get a response. So if you just say, you know, I got to tell you something, I have Parkinson's disease and I'm doing well. You don't have to do the consoling, but if you go the other way around, all of a sudden you're consoling them, and because they feel so bad. So I think that, but there's something missing in the diagnosis, because I didn't leave my doctor's office feeling okay about my diagnosis. And so, and I know lots of people who feel the same way. Lots of people who didn't accept the first diagnosis and went to a second or third, you know, consultation. So there's something missing in the medical field here, where trying to get an opportunity to create a partnership with the patient, it doesn't really happen, at least not at that first visit. They are typically given a prescription and told to return with very little information. And so your mind, you know, can run wild. I mean, there's an image that at least physicians have seen it. If you Google Parkinson's disease, you'll see a line drawing of a older man hunched over, little shuffle signs on the side. You know what I'm talking about, Dan. You know, it is the universal picture that represents Parkinson's disease. Right. Now,
as he described it.
Right, and it was that drawing is over 100 years old. So, the thing is that if you Google MS, you will see pictures of myelin sheaths, but you will not see somebody depicted as somebody who has MS. And so, in my opinion, part of the stigma of Parkinson's comes from that image, because it's all people know. They know that image. And so they think of, you know, if that guy walked into your office, you would have no problems diagnosing his Parkinson's disease. He's got Parkinson's, he's got advanced stage Parkinson's. But what about those of us who don't look like we have Parkinson's disease? We don't get diagnosed quite so well. So I think that there's a lot of education that needs to be done about Parkinson's, about what the non-motor symptoms are, especially when they're grouped together. You know, REM sleep disorder behavior is Parkinson's until proven otherwise. So, right. You know, there's a lot of information that has to happen, and it doesn't really happen at the patient level early on. I don't think. We have to find out for ourselves. We got to roll up our sleeves and figure out what's going on.
You know, along those lines, Sharon added a comment that says, I find that the medical community doesn't fully understand PD. There's very little empathy. They need to learn, they need to feel a PD diagnosis made me unemployable. Nothing is further from the truth.
Well, I agree with her. And as a physician, I think that that's often the case. There's oftentimes people with Parkinson's get told the very first visit, there are worse diagnoses that you can get. Well, you know, when you're dealing with somebody who just told you had Parkinson's disease and you weren't expecting that diagnosis, I don't want to know about the worst things I could get. So, you know, and the physician who diagnosed me didn't want to tell me. I mean, I had to like pry it out of him. And then, you know, he was uncomfortable telling me. And that was probably my first exposure to the stigma of Parkinson's disease. If the physician can't handle telling you it, then, you know, it's not a good way to start.
Yeah.
So.
I'd just echo all of that, and is the one who's not a physician on the panel today. You know, what I have found, and you all correct me if I'm wrong, but I think sometimes doctors are so afraid that they're going to overpromise someone that they don't provide enough encouragement, right? And so, you know, what I think is helpful to what Karen was saying is to let people know this isn't a death sentence.
Right.
For most people, it progresses very slowly, you know, decades of, you know, slow progression. You know, most people, you know, the drugs work very well for a long period of time. I mean, little nuggets of hope
Right.
very early on can go a long way to sort of getting people to a baseline where they can sort of begin to, you know, get their minds around this, if you will. But I think sometimes physicians are too cautious not to kind of overpromise folks that quote unquote everything's going to be okay, that maybe they don't offer enough in the way of encouragement.
Well, there hasn't been any, and like I said in my talk, you know, the cancer centers have really stepped up. You know, there's every major medical center has you know, when people get diagnosed with cancer, they get put into this system of social workers and nurses and people who can provide care from the get-go. It doesn't seem to be happening universally with Parkinson's disease.
Yeah.
Right.
It would be helpful, you know, because Parkinson's disease is every day for the rest of their lives. I mean, we don't have a cure, so.
Yeah. Well, the doctor who diagnosed me after a misdiagnosis, I finally got to a movement disorder specialist, and very seasoned doctor who had seen it all over the course of a career. He was at the end of his career. And he said, you know, not the first visit, but on a subsequent visit, he said, you know, Allan, something else is going to get you.
Right.
And that was sort of his way of saying it's going to be okay. You know, you're going to manage this for a long time. It's going to be you know, a burden, but you'll manage it. And then something else is going to get you like something gets everybody. Right. For me, that helped a lot, just to know that, you know, this wasn't the kind of final thing for me.
You know, so much focus, at least on observation, is on the motor difficulties that accompany Parkinson disease. But, you know, the non-motor seems to often be more challenging than the motor symptoms. And here's a comment in the question. It says, I woke myself up last night singing Somos el Barco. I take it that's some kind of song. I don't know. What about sleep with you all? How have you been in terms of, you know, getting a good night's rest and how it impacts the rest of your day?
Well, since I've retired, my definition of a good night's rest is different because I don't have the pressure of having to go to work. I feel less pressure to have to go to bed. So I tend to go to bed much later than I should and wake up when I would normally wake up. So, you know, for me, I get like 5 hours. But over the past couple of years, I've developed problems with nightmares. And I don't act out my dreams, but I do have nightmares. And I take melatonin for that, and it helps. But I don't get as much sleep as most people do. But I'm not tired during the day either. So I feel like it's, you know,
I have a friend that boxes with me. He said that the best thing that's happened to him from DBS is better sleep. Now, I don't think anybody can say that in the office, talking about DBS as a promise, but it's interesting that the most important thing for him is a good night's sleep. I think that speaks worlds about the illness versus the disease. The illness, nobody knows about the insomnia issue with Parkinson's. The medical community doesn't know, Karen, like you were saying. I found that I'd practiced 28 years of general internal medicine. I knew nothing about Parkinson's. I knew about Compen and Cinnamon, but I didn't really know much about the disease.
It makes me feel better as an OB who didn't know.
Yeah.
Yeah, sleep that's been probably my biggest challenge as far as symptoms go. And mine has been related more so to medication. And in fact, you know, trying to time my medications differently has helped a great deal. People react differently to the medications. I mean, you know, I'm on carbidopa, levodopa, like everybody eventually will be with Parkinson's. And that's taken some tweaking with respect to when I take my dosings. But yeah, sleep can be a problem. But again, there are ways to manage it that, you know, that most people find relief in.
A lot of conversations go around finding your management team, you know, your care team. What what have you guys surrounded yourself with in terms of a team?
Well, for me, my team is basically my husband and my physician, who I don't see very often because we're both co-founders at InMotion. So I see him, he sees me in action on a regular basis. So I don't often stop in to actually have an appointment with him. But I would have to say InMotion is a huge support for me. I mean, the people there, the clients there, you know, I'm a founder, I'm a board member, and I'm a client. And so, you know, I wear multiple hats over there, and that's a big, I spend a lot of time there. So I would say that those are my biggest support. That's part of my biggest leaders in my team.
You don't have to pay a copay each time you run into them, do you?
Thank goodness, no. I tell them what to do sometimes, so that's good.
Dr.
Well,
Cole and Dr. Stultz?
Go ahead.
I have a movement disorder neurologist, an internist who's a good internist. She's knowledgeable yet not overbearing. And then I see a speech therapist. I just started last month and working on speech. And I have physical therapy, but really I have a boxing coach. She does all what I use for physical therapy, really more or less boxing. And that's the team. I'm on 2 foundations. Well, I'm on this not a big group that's not yet a not-for-profit. And then I'm on another foundation that gives gifts to individuals who can't participate in boxing because they can't afford it. So that's my support. My daughter also teaches rock steady boxing in Houston, so she's a soundboard for me. Excuse me, Al.
No, that's okay. Sorry, I cut you off. Well, medically, I mean, I have a great primary care physician. I think that's really key. I have a movement disorder specialist who Dan and I share. She's wonderful. I work with a speech therapist too. I wanted to get out in front of some of the voice issues and speech issues. And so I sort of, because I use my voice a lot, I wanted to make sure I was doing it in the right way. And so I see her periodically just to sort of fine tune things, hoping that will help my voice strength over the longer haul, which, by the way, I recommend if you can do it to sort of prophylactically get in some of these sort of routines. I see a physical therapist when I'm running because I inevitably have injuries that I have to deal with. But that's my medical team. And then actually I have a therapist that I talk to occasionally just because I'm in that business and I think it's really important for people to have someone to talk to that who's trained and objective and all of that. And then lots of friends and colleagues and people in the Parkinson's community who, prop me up when I need to be propped up.
Great. We have a question. Let's see. I have many medical issues. How can I tell with certainty which are related to Parkinson's disease? And we hear often, someone will bring something up in their appointment and, their doctor will say, well, you have Parkinson's disease. How do you know which is which?
Well,
I'll let the doctors answer that one. I don't know.
The truth is that you don't always know. And here's a good example. I once had but what's interesting is whether patients take medication or not. There's this funny thing with Parkinson's disease where people don't want to take their medications. They want to put it off as long as they can. And when people find out I'm a physician, they often want to ask me questions, even though I'm an OB and not a neurologist. So this fellow came up and he's about 70. He has a big tremor in his hand, big tremor. And he asked me whether his back rigidity was from his Parkinson's. And I mentioned that, back stuff can be from a lot of different things. I said, what medication do you take? He says, I don't take any medication. I said, why not? He said, because my doctor said to me, why would I want to spend the rest of my life taking a medication? I said, because you might want to feel better now when you're 70 and not wait till you're 80. So, some things are, especially when it comes to musculoskeletal stuff, it's hard to know. My shoulder thing, I would have never guessed that was Parkinson's, but in fact it was. And a lot of people actually get shoulder surgery on a frozen shoulder, thinking that it's that when it's really Parkinson's disease. So the musculoskeletal things of aging look a lot like Parkinson's disease, but they're not going to get better. I mean, if you have a diagnosis of Parkinson's disease and you're having pain, you might need to reevaluate your medication regimen and see what you're on and whether you're taking enough medication. Oftentimes people aren't taking a proper dose of medication and they're not getting the benefits from the medications that they're taking. I always teach in my PD 101 class that if you're taking a medication for a symptom, so let's say you have a tremor and they gave you a medication and it's not doing anything for it, then that's not the medication you should be taking, because we don't have a medication that addresses a cure at all. Nothing changes the progression of the disease. We only have medications that treat symptoms. So if the medication you're taking for a symptom isn't working, talk to your doctor about that, because you need a different medication.
Here's a question from one of our great support group leaders, Karen. Do you have any advice for the medical community and people with Parkinson who are support group hesitant?
Haven't talked to me and Allan. The truth is that you have these images of something terrible, and every support group I've been to, yeah, there may have been people that were more advanced than me, but for the most part, people look pretty great. And it's really, it's amazing what it's, at In Motion, everybody, all the clients here have Parkinson's. It's not like they talk about Parkinson's in the morning, noon, and night, but they know, they feel safe there because everybody has Parkinson's and it's a shared experience and they understand the language and the experiences of Parkinson's disease. And so it is a place where, if you fell down, somebody would pick you up and not make it, much of a deal about it. You just, I really recommend that people not do this alone.
Yeah, you want to tell that doctor to find somebody to see about his control needs.
Well, and I suspect that, the physicians that are saying that have probably never attended a support group too. And they don't really understand, what happens there.
If I could just add to that, from a person who's not a physician, but I know a lot of physicians, and I talked to a fair number of them about Parkinson's, and I really think it goes a long way for people like Karen and Dan and Michael Oken and Boss Bloom and others that are physicians and very seasoned and knowledgeable, who also are plugged into the Parkinson's world, either because they have it or because they study it and care for people, to really work on sort of destigmatizing things like therapy and support groups and antidepressants and things like that, because all these are part of a successful treatment plan for many people. And if they hear it coming from the most expert medically and otherwise, maybe that helps move the needle some and getting folks to access those services.
Absolutely, Allan. Absolutely. Them coming together to write the book, Ending Parkinson's, is something that puts it out there and kind of sort of lets people, deal with it on a personal but more, open basis.
Right. Yeah, and Ray Dorsey, you mentioned Ray Dorsey. He's another one who's part of that group. Who they just really, what I love many things about all of them, and certainly appreciate the work they do, but they're among the most human physicians I've ever met, because they just really meet people where they are, and they speak in lay terms, and they're collaborative. I think, again, that's really important, to find a doctor who's collaborative, who brings his own expertise, but also recognizes the patient's expertise, which is equally valid in my opinion. I think the takeaway for me is surround yourself with medical experts who have that kind of bent toward any kind of illness, Parkinson's included.
You've talked about the stigma that can be associated with the disease, and the silence that maybe it encourages. What would you tell folks about being more vocal, not only in terms of the disease, but kind of developing the Parkinson's community, growing it?
Well, I know for me, the big hurdle for me, there were two big hurdles. One was the, sort of the professional hurdle. I mean, I was diagnosed at 46, sort of mid-career, just kind of hitting my stride, I thought, and I worried a lot about, again, the misperceptions and the sort of lack of information, and being sort of relegated to someone, to being someone whose best days were behind him, quote unquote, right? And so there's a big risk in being public for those who are still working and who have presumably a lot of years to work. Not that there aren't risks for folks who aren't working, I don't mean that, but I think there are particular kinds of risks that people professionally face if they're public. And then on the kind of personal side, I mean, none of us want to be pitied, right? And none of us want to be avoided because people don't know what to say, or they're afraid they're going to say the wrong thing, or that kind of thing. So I think it's risky to be public. I don't want to minimize that. At the same time, I think, for me, and I hear Karen saying the same thing, there are other risks that come with not being public, right? And sort of the toll it can take on your own mental health, among other things. So, but for me, it was the professional sort of piece, and then the personal piece, not wanting to be pitied and sort of written off.
For me, part of the problem was that we had planned to keep it secret, and that included not telling our children, because my oldest was getting ready to go to college, and we didn't want her to make a decision about going and not wanting to go because of my diagnosis. But unfortunately, one of the 3 girls found out, and so we had to tell the other 2. So now the 3 of them are in cahoots with us, and it was not easy. It was especially hard on my youngest, who was 13 at the time, and it was not easy. So that was something that I wished I had done differently, but I just wasn't wasn't prepared to tell the world yet. I just didn't know how much stigma it was going to be. When you're a surgeon, it just, I could operate just fine. I had no problems whatsoever, but that's not what people think. There's a perception that you're not able to. So
Right.
that was really hard.
Yeah, in that case, perception becomes the reality.
Mm-hmm.
So.
Which is, if I may just real quickly, David, all the more reason for people to talk about it, right? And to destigmatize it by showing that you can still do constructive things and make, a difference in whatever sector you're in, and you happen to have Parkinson's, right? I think it just takes sort of test cases being willing to show that over time helps to move the needle on that. But it's risky. I don't want to minimize that either. It's not a one size fits all.
Yeah, again, not having Parkinson's disease, I hate to, inject too much of my own thoughts, but I could see that the more you internalize it, the more of a burden it is, and it is much more limiting to what you will or can do.
Well, for me, just like Allan said, I mean, you've got to be able to see who you are yourself. Parkinson's shouldn't define you, and it can, and especially if you have some depression associated with your Parkinson's, or you had it beforehand, it can paralyze you. It really can. And there are people that never leave the house after they get diagnosed.
Right.
So it's, but there aren't that many things that are so stigmatizing as Parkinson's. I think of HIV/AIDS is one, mental illness is another. Now COVID. If you have COVID, you feel like you don't want to tell people because you feel like you've done something wrong. Right. So I think that there's few things that are stigmatizing as Parkinson's disease is. And I think it just takes one person at a time to step up and say, I'm going to do the job that I was trained to do, and I can do that job, and I'll take my cues when I can't do that anymore. So.
Here's a question. It says, since COVID, we can get a lot of support and information via the internet, but it's like drinking from a fire hose. How have you dealt with COVID and Parkinson's with the whole virtual situation?
Well, for myself, I think I've had Parkinson's disease long enough that I don't kind of sort of need the Parkinson's support as much as I did before. So, and then I've got emotion. So if I want a Parkinson's patient, I can find them in every Zoom class that we do. So I haven't, and for our clients at InMotion, they've had the classes, all of our classes are online, so they can find it there. And we continued to actually see new patients the entire time that we were closed. We just onboarded them online and they could join that way. So I didn't, certainly COVID impacted us a lot. We would have rather been in our building than having to do this online, but at least we had a mechanism with which to do that. So.
Yeah, good.
I mean, I think we're all zoomed out, in a lot of ways, but I mean, the good news is like today, I mean, there are people here on this call, I assume that wouldn't be able to make it in person. And, I'm on the board of an organization called Power for Parkinson's here in the Central Texas area that provides free exercise, dance, and singing classes to folks around this part of Texas. And, like in Motion, we had to move everything online. And there was a loss that came with that, the sort of face-to-face on the ground connection. But the gain has been that our, number of users and clients has grown by virtue of people being able to access the services in ways that they either couldn't or chose not to in the past. So I think we'll all be ready to get back to whatever the new normal is going to be, less virtual. But I think the benefits of virtual work and community and networks is here to stay. I hope it is, because I think we've gained some things too.
Mm-hmm. Yeah. I think we're starting to wrap things up. One final idea is that, as the disease progresses, what are your feelings about kind of the direct correlation in terms of the Parkinson's community support? Do you think as the disease progresses, the community becomes more important, less important?
Maybe it becomes more important for the care partners. I mean, I can imagine that, because it can become more burdensome over time, not just for the person with Parkinson's, but for the people around that person. I mean, I'm just imagining, because I'm not there yet, but my sense is that support's always important. I mean, I believe that on principle. We may dip in and out of the need. Most of us probably do over time, but I think when times get more difficult, by and large, most of us benefit more from support than we benefit from not having it. So I mean, I would think that it would become more important certainly for caregivers, but also for people with Parkinson's too.
Yeah, generally I would agree. I think the caregiver portion will become more important. But again, if you've seen one, you've seen one.
Mm.
Everybody's different. There's no two cases. We lost a boxer unexpectedly at the end of last year, and nobody knew he was that sick, and he died from pneumonia. Well, nobody saw that coming. So he didn't have a chance really to grow old. Something, as Allan said, something else got him, probably related to Parkinson's, but he didn't. I never saw him cough. Never saw him have difficulty swallowing water. So I think it was probably a random event, but it shocked our boxing group pretty good. His wife is very active.
When you were talking about your friend, you referred to him as the boxer, not a person with Parkinson's disease. So, what's the importance? Can you kind of give your feelings on the importance of identity while you're living with Parkinson's disease?
Yeah, I think that's kind of part of that dark humor that comes with having Parkinson's disease. The boxing group is kind of a brotherhood, and that's our small community. I don't know much else to add to that.
Anything else you think is important for our folks to know? Any final thoughts or lessons that you've learned that you'd like to pass along?
Well, I mean, I chat with a lot of recently diagnosed folks, and particularly folks who are younger. And one of the things I always say to them is what I wanted someone to say to me, because it's true, and that's, it's going to be okay. You know, life will be different, it'll be challenging, but for almost everybody, it's going to be okay for a long period of time. And I believe that, I've seen it. And I think if we can live into that initially, it sort of prepares us better for, you know, the hurdles or the speed bumps or the brick walls that we will eventually run into. You know, how you start, I think, has a lot to do with how you travel. And you know, for me, hearing that it's going to be okay from people who know made a big difference.
I couldn't agree with you more, Alan. But it's not only that, but I mean, it's very true that I have great, I mean, I wouldn't know any of you. I mean, the number of friends that I've made since I get diagnosed with Parkinson's, the work that I've done is really rewarding and fulfilling. I'm very proud of the work that I've done. But there's a lot of benefits, and like Michael said, for everything he's lost from this disease, he's gained something of much greater value. I couldn't agree more. For me, I'm lucky to say that that's the case. It's not true for everybody, but it can be for many, many people.
Well, I think for once, we're going to actually wrap up a little earlier, at least on time. So I want to thank you guys so much for giving up a Saturday, and not just giving up a Saturday, but for all the stuff that you're doing for the Parkinson's community, not just regionally or nationally, but internationally. You add so much hope, where oftentimes folks do feel helpless or hopeless anyway. And, you know, we're wrapping up April, and I always hear, oh, we're going to celebrate Parkinson Awareness Month. You know, I don't know how you celebrate a disease. So our hope was to inspire and encourage folks through this. And I think you have definitely done that, at least, you know, not having the disease. I feel uplifted and inspired also by what you guys are doing. So thank you very, very much.
Well, I want to say, just on behalf of the group too, thanks to the Parkinson's Foundation and particularly there in Western PA for the work you do. It makes a big difference in lots of people's lives, and just honored to be on this panel and to have an opportunity to learn more about your community. So thank you.
Thank you.
Thank you,
Me
guys.
too.
And you're all welcome to stop in Pittsburgh anytime. Your travels take you around the world. Just come and hang out with us.
Beautiful city. Thank you.
Thanks for being on, everybody.
Okay. Thank you. Take care.
Have a good day.
Bye-bye.
Wow.
Wow is right.
Wow.
Well, if you were with us last week, I think we were all inspired by the screening of Capturing Grace, and that inspiration continued today tenfold. I'm so grateful to the panelists for their willingness to be honest and vulnerable and share their wise words with us. And it's pumped me up to continue the fight. And I think that's one of the key messages is, you know, gather your strength, fight back against the animal, and take charge to the extent that you can over the progression of this disease. So thank you all so very much. Another really hearty thanks to our sponsors, Amneal and Encompass Health, who enabled us to put on this program today. And now I'm going to turn it over to Emily, who's going to chat a little bit about how the recordings will be distributed and the emails that will include some of our upcoming program.
Yeah, so later today, everyone will receive an email that's going to have a few things in it. One thing is it's going to have a link to watch all of these presentations again, which will be on our YouTube channel, which you are welcome to watch. Or if you know someone who missed today's event, you can forward that over to them. It is also going to include some information about some really cool upcoming programming that we will be doing that I'm going to toss it over in just a moment to Casey and Dave to talk a little bit more about. And it's also going to include a link to our calendar to have you guys who haven't yet had the opportunity to go over and look at all of the amazing classes that we offer for our no-cost virtual exercise studio. Casey and David, it's been a couple months now, have worked and continue to work so hard, bringing such a really cool, diverse array of no-cost programming that I can let them speak to as well. But all that information is going to be included on the email that gets sent out to you guys today. So with that, I'm going to hand it over to Casey and David to speak a little more about the programming and classes that will be in that email.
Thank you, Emily.
Yes, thanks, Emily.
Take it away, Casey.
Okay, to conclude Parkinson's Awareness Month, this coming Tuesday at 3 p.m., there's a webinar about a new treatment for OFF episodes presented by Synovian, one of our sponsors. This Tuesday, 3 to 4 p.m., that link to register will be included in the follow-up email. And also this coming week on Thursday, our inaugural book club is starting, and Christine, our lovely Christine, is leading that book club this Thursday at noon. Again, the registration link will be in the follow-up email. And then to conclude the upcoming programs, for the moment, there will always be more. On Tuesday, May 11th, our webinar on deep brain stimulation will be conducted by Dr. Donald Whiting, and that will be from 12 to 1 p.m. and also in the follow-up email. And then I'll let David touch on the virtual exercise studio, and then I think we'll wrap it up.
Yay, thank you. Yeah, we are continuing the exercise classes in this first kind of pilot session through May. So make sure you continue to sign up. It snowed this week, so people probably weren't out walking unless they had their booties on. Western PA weather can be crazy. It's nice to have the opportunity and the option just to stay at home, but still be able to exercise with a group of folks. And I think we're in probably our 4th month now, and people are probably getting to know each other. So we're in the process of figuring out a schedule for beginning in June through the summer anyway. And it's going to kind of depend on COVID a little bit, but we want to keep your favorite classes in place. So keep signing up, keep jumping on.
Well, that's it from us, guys. Goodbye from the staff. Enjoy the rest of your weekend.
Thanks
See you,
for
love you,
joining.
bye.
Bye.
Bye-bye.